Today, a CDC advisory panel made some major changes to the COVID-19 vaccine recommendations. Atlanta News First, Niamani Watson is live outside of the CDC headquarters tonight. And Niamani, you spoke with a former CDC doctor about these changes.
Yeah, one of the changes is for the CDC to no longer recommend the COVID-19 vaccine for everyone. The former CDC doctor says some of these changes are concerning. Currently, the CDC recommends the COVID-19 vaccine for most adults. Friday, the CDC Advisory Committee voted not to recommend the shot for everyone and instead encouraged people to consult a healthcare provider. Former CDC infectious disease specialist Dr. Anthony Fiore says this could actually create a barrier for some people.
Many people don't have a primary care doctor. They can't necessarily get in for an office visit,
making it harder to get the shot.
I think what we'll see is fewer people getting vaccinated, and that concerns me because the vaccine works really well.
The decision came during the Advisory Committee on Immunization Practice meeting. While the panel says it should be left up to each individual person if they want to get the shot, it encourages people at higher risk of getting the virus to get vaccinated, like seniors or those with chronic illnesses. The committee also narrowly voted to not require a prescription for the vaccine, something Dr. Fiore says would have been more of a burden on the healthcare system.
So the thought of 100 million people calling up their doctor and asking for a prescription, it's just not realistic.
Back in June, Health Secretary Robert F. Kennedy Jr. appointed new advisors to the committee. Dr. Fiore says he believes the two-day meeting created more uncertainty for people who may want to get vaccinated.
I'm worried that subsequent meetings with the same panel will also inject confusion and fear.
Now, the chair of the ACIP says that people can trust these recommendations because they are based on science and public health principles. The director of the CDC must approve these recommendations before it becomes official guidance. Live outside of the CDC headquarters, I'm Niamani Watson, Atlanta News First.